Hello, it's my pleasure and delight to have you join us on this week's edition of the program Healthcare. My name is Rebecca Giot, and Healthcare is coming to you live from the Plateau Radio Television Corporation here in Jos. It's always a moment of delight because we sure have something that we want to put across to you. We want to inform you. We want to educate you. We want to encourage you some of the traditions that we were used to. We want to tell you that we have better ways of going about the whole process. And so this week on healthcare, from the 1st to the 7th is World Breastfeeding Week. And I'm sure that virtually, let me say, 99 to 99 point something percent, that is my own perception, must have passed through the breast milk. So we want to look at the issue of breastfeeding. And for this year, we are saying breastfeeding for a sustainable start in life. Strengthen what works. So that will be our focus today on health care. And I'm sure that you will give us your time so that you get to understand better. So with me in the studio, by my immediate right, is Nyam Kemin Kim. She is a registrar, Department of Community Medicine, Jos University Teaching Hospital. You're welcome.
Thank you for having me.
Yes. And by my far right is Lucy Uregu Ije. She is a registrar, Department of Obstetrics and Gynecology, Bingham University Teaching Hospital, Jos. She is the Young Doctors Forum Coordinator, Medical Women Association of Nigeria. You're welcome.
Thank you so much. It's my pleasure to be here.
Yes. So all of them are medical doctors. So I'm glad to have you on the program.
Thank you, Ma.
Yes. So like I mentioned to you, our viewer, I said 1st to 7th is World Breastfeeding Week. What is it that you know about breastfeeding? What is it that you still should know? What is that thing that you should strengthen? What is that thing that must be sustained? That will be our focus on the program. So we'll start with Dr. Nyam. Breastfeeding. So when we talked about breastfeeding, what is breastfeeding and when does it start?
Thank you. Breastfeeding can be termed a natural process of feeding a newborn baby and a baby or infant. Now, a baby that is born in for less than 28 days is called a neonate, and a baby from 28 days up to 1 year is an infant. And then beyond, we have toddlers and so on and so forth. So breastfeeding is a natural process of feeding babies, these children that are born to us, these blessings that we have. And it is done by latching the baby to the breast, and then the natural breast milk or the human milk is being fed to this baby. Usually, breastfeeding should start from the first hour of delivery. So immediately the baby is born and cleaned up, the baby is being latched to the breast, and breastfeeding is supposed to be commenced. This has so many benefits. Over the years, with research, it has been shown that there are lots of benefits to immediate latching or immediate commencement of breastfeeding. So it is advised, the World Health Organization has said or recommended that a baby should be exclusively breastfed for the first 6 months of their life. First 6 months, what does it mean to be exclusively breastfed? It means the baby does not take any other thing other than breast milk. So just breast milk, no water, no pap, nothing. And then in few occasions, if there is need, then prescribed medications can be given. If not, it should just be breast milk.
Wow. Okay, we'll come to dwell more, especially on this issue of exclusive breastfeeding. So, Dr. EJ, now she is saying that is the first thing you do once that baby is born, after the baby is being cleaned, and you put the baby to the breast milk. But I know that when some of us were growing up, when some of us gave birth to our, first child, there was that dirty milk that we had to discard of it so that it will not affect the baby. So How do we go about that?
All right, thank you so much. First and foremost, I want to say happy breastfeeding week to all our mothers and even their children, yeah, worldwide. This is one of the myths which I hope that we are going to tackle to tell you the fact. Breast milk, as my colleague has said, is a natural phenomenon, is a biological substance. It is God's gift to humans. All right. So there is nothing impure or dirty about breast milk. Some go as far as to say that that first milk that comes out, which is called colostrum, is witch milk. And because of that, it is being discarded. Okay, that had been the practice in the past. But this colostrum is one of the most important part of breast milk and breastfeeding. In the first few days of life, this is the breast milk that is being fed. This is the breast milk that is being produced. All right. So when a woman, when the baby is born, the placenta is delivered. Okay. So much happens, which we still delve into, and then signals are being sent to the brain, to release hormone that stimulate all of this, plus, the suckling reflex of the baby. So colostrum is very important. It is, in short, it is called baby's first vaccine.
Okay.
It contains immunoglobulin, especially immunoglobulin A, which is secretory. This help in what? Protecting the mucosa surfaces of the baby, the respiratory mucosa, the gastrointestinal mucosa, which is so protective to this baby. So it is a bad practice, but that is where we have this avenue to enlighten our people out there that it is not dirty, it is not witch milk, it is the richest, it is what helps in fighting or even building the immunity of every born baby. Not only does it contains immunoglobulins, it contains other immune cells too. It contains proteins. It has other, nutritious substance,
Okay.
which should never be discarded.
Wow.
Yeah.
So you said it is safe, you say it is natural.
Yes.
Okay, what if the breastfeeding mother
Mm.
is sick? Is that breast milk still safe for the child?
Now, what kind of sickness? Okay, that is where it comes. What kind of sickness? A woman who has malaria has nothing to do. If only that, for example, that particular breast is cancerous. If that breast is cancerous, we will not advise the woman to feed the baby with that breast. We've managed women like that. Okay, if what you term as dirty or dirt might be that the pores, the nipple has some pores, all right, which are clogged over the years before pregnancy and delivery. So like after delivery, the nipple should be cleaned. When you clean it with a wet towel, you will see that there are some blackish or black particles that are coming out of the nipple. Those are the substances that have clogged and closed those pores. But the moment you clean them and they are removed, it opens up the passageway for the breast milk to come out. So there is nothing dirty about that. Okay, every baby should be put to breast within the first hour of life.
Oh, yes. I love that there is nothing dirty about it. So some of the practices were simply maybe myths and misconceptions. So, Dr. Yam, now before delivery, maybe during antenatal, before the mother gives birth, is there anything she should do to the breast, maybe so that the nipple will come out before the baby is delivered?
Yes. So this will be me advocating for antenatal. Please, the moment you know that you are pregnant, it is very important for you to get to the closest good facility, health facility, and then register for antenatal. During antenatal, you get to learn about so many things about the pregnancy, about the baby, and what to do when the baby comes. And one of it would be how you take care of your breast to make sure that you have optimum breast milk production and then feeding the baby properly. Now, talking about what to do, usually during pregnancy, the woman is examined during her antenatal, and the breasts are examined. The nipples are looked at. She talked about materials or dead skin cells clogging the pores of the nipple where the baby latches onto. So at that point, you are told how to clean the nipple. One of it is by using warm cloth. It could be the use of cotton wool and warm water or even oil to make sure that the nipple is clean. Another thing is that when the nipple, some ladies have inverted nipples. Yes. So at that point, she would be advised to do some processes, so to speak, or exercises on the nipple to make sure that they are pointy by pulling out the nipple gently. This is something that she could do at her convenience even before the baby comes, so there is no tension and she is able to do it gently to avoid any pain. So pulling out the nipple mechanically is something that a mother could do. And then we talked about the mother being ill, or if there's maybe a cancer on the breast. Yes, at that point there's going to be a special consultation, and then the mother is stopped from feeding the baby. Sometimes there could be abscess. Okay, there could be other diseases affecting the breast locally. At that level, then the doctor is able to speak with the mother, and then treatment is done, or breastfeeding is withheld for a period of time. There are also women, on the outer scale that have illnesses that could be transmitted to the child through breast milk. At that point, treatment is started, is begun. For instance, if a patient has HIV, you make sure that the mother starts her medication, because actually now HIV is not enough reason not to breastfeed. That's to show you how important breastfeeding is. Yeah, so at that point, the mother has to take her medications, you enroll her in all those classes, and breastfeeding, further things are done to the mother to ensure that breastfeeding takes place immediately after the baby comes.
Okay. Yes. And just to add to what she said, so especially this is actually particularly to women who are pregnant for the first time. Okay, so the breasts are thoroughly examined, as she has said. Okay, you see some women whose nipple is it retracted or flat. These are women that may have problem. Like she has said, you can mechanically, try to draw it. Yes, even before delivery, your husband can help, your partner can help to, suck it out. Then I do know that nurses have there's this syringe they use in trying to draw it out. So there are some other methods, just to add to what she said, that can help in bringing. But that you doing it yourself goes a very long way to to bring out the nipple.
Okay.
Yeah.
Yes, you said first time moms.
Yes.
So this breastfeeding,
Yes.
how should she do it? Are there some techniques? Are there some ways that mother should be able to put the child to the breast milk? Yes,
there are. Despite breastfeeding is natural, it entails knowledge. It is something you do with knowledge. Many first-time moms fall victims of this, especially for women that don't even have mothers, or that didn't attend antenatal care, that didn't attend those lessons during antenatal. So some just give birth, especially those teenagers, okay, without experience, without knowledge, and they really get these things wrong. Yes, so with me, I have a mannequin that I want to use to demonstrate how a woman should position and then latch, or the baby latch on the breast. Okay. So with me here is baby Ngozi. So with me here is baby Ngozi. You can see baby Ngozi is very beautiful. She had just been given birth to, and she's very hungry, and she needs to eat. So the first thing is positioning. The mother must be well positioned. She should sit upright, balance herself. She should be very comfortable. You can go ahead and cross your leg. You must ensure that you are comfortable. You can use breastfeeding pillows. You can use other supports to ensure that you are comfortable. And I tell my women that even as you are breastfeeding, you can be doing your nails, you can be sipping your tea or your juice, you can be watching. That is how comfortable breastfeeding should be. All right. So you have your baby, you are seated upright. Your baby's head, this is my elbow, right? The baby's head is on the elbow, is supported by the elbow. Okay, and then the palm, your palm is on the what? On the buttock of the baby. The baby's tummy, okay, faces you. All right. And then even just with one hand, you can hold your baby conveniently and use the other hand to do any other thing that you want to do. Then that is positioning, right? Then attachment. How does the baby attach? Now, the baby is brought to the breast. All right. I'm not bending.
Okay.
I'm not taking myself to the baby. I'm not taking my breast to the baby. I'm carrying the baby to myself, to my breast. All right. Then you see that the baby's mouth is widely open to cover the dark area, which is called the areola, complex, especially feeling the lower part of it. And then how do you know that the baby is really sucking well, is getting enough? At times you hear the sound, the baby is making those you hear them, and then the mouth of the baby is full. Like, you will just see those things. And when the baby is really sucking, you see that the baby will not be crying. All right. So these are some of the ways you do. I tell you, breastfeeding is very simple to do. It's not something that should burden you. Many women don't want to breastfeed, or they have really not been breastfeeding well as a result of lack of knowledge. So even as I walk, if I stand up to walk with this baby, I can be breastfeeding the baby. It is that simple.
What if you are sleeping and the baby is crying in the night?
Yes. So there's this concept of breastfeed on demand. Anytime the baby cries, it's just a clue to let you know that the baby wants to breastfeed. You wake up and breastfeed the baby. You sit up and breastfeed the baby. And do you know that in the hospital?
Okay, you sit up.
Yeah, you sit up and breastfeed.
You are feeling sleepy.
Yes. The best thing is to sit up and breastfeed the baby. If you lie down to breastfeed the baby, there's possibility of the breast milk entering the baby's ear canal. Okay, that will lead to ear infection later in life.
Okay, thank you.
Thank you, ma'am.
Okay, so Dr. Nyam.
Yes, ma'am.
Now this baby Ngozi,
Yes.
that has been put to the breast, for how long should baby Ngozi be put to one breast?
Okay. Now, when breastfeeding the baby, there are different stages. Early on in life, the baby tends to suckle for a longer period of time, for 30 to 60 minutes. So it can actually be that long. And as a new mom, we would just think, it's not even up to, we say that you should breastfeed on demand or at least 2 hourly.
Yeah.
Yes. So the baby could suckle for that long. And that's because the baby doesn't have that stamina or the energy to suckle so fast. So it's very slow. The baby sucks and rests. So for the newborn, yes, that's the neonate, breastfeeding could take that long, for up to 30 to 60 minutes. But the catch here would be that make sure that the baby empties one breast before you change the baby to the next. So usually for one feed, you suckle, the baby should suckle on only one breast.
Okay.
Then by the next feed, you could now switch over to the next. And that is because breast milk has two phases, so to speak. There's the foremilk and the hind milk. So initially, when the baby starts suckling, the foremilk is more like water, trying to quench the thirst and all of that. It has the vitamins and the antibodies. However, the hind milk comes with a lot of fat, and that's what actually helps your baby to grow, to be chubby and all of that, to be healthy. So that is why it's important to ensure that, okay, for the newborn babies, you've breastfeed for at least 30 minutes. For the older babies, because they can suck faster, make sure that they empty the breast before you put them down, or until they say they're okay.
Okay.
Yes, ma'am.
That's beautiful. So initially you've mentioned this issue of exclusive breastfeeding, and you said except otherwise, if the baby is sick, maybe the baby is given medication. But I know one thing, that water is life.
Mm.
So now this baby for 6 months, no water. Are we actually helping this baby?
Yes, we are. Like we said, it's natural. It's God's gift to man or to humans, right? And breast milk, actually, the tests have been done. It's proven fact. Breast milk contains enough water that the baby needs for the first 6 months. So there is no need to give water. Breast milk is over 90% water. So whatever needs or water needs that the baby has, the breast milk will take care of it.
Okay.
And another disadvantage will be if you give water, the baby's tummy is not so big anyway. So you give water, then water takes up the space of breast milk that would have been more beneficial to the baby.
Thank you.
Yes.
Dr. Lucy, this year's team is saying that breastfeeding for a sustainable start in life, strengthen what works. How?
Yeah, so this is the global team.
Yeah.
This is the global team, strengthen what works. What have been working? There have been a lot of work in promoting breastfeeding globally. Lot of interventions. Okay, one of such interventions is skilled infant and and young children counseling. Remember I said that breastfeeding, despite it's natural, breastfeeding is something one does with knowledge. All right. So even the those supporting breastfeeding mothers like healthcare workers, community workers, they need adequate knowledge. They need to be taught empathy, compassion. I work in the hospital and we see a number of people that are not so patient. Some can't even put themselves in the shoes of the patients. All right. So they need to be taught the act of counseling, how to counsel the mother, how to teach those techniques that I just demonstrated a while ago. That is one. Two is the international code for marketing breast milk substitute. It is a code that is developed by WHO. And what it seeks to do is that it seeks to promote breastfeeding and to discourage breast milk substitute until or except it is absolutely necessary. For some children that might not, be able to feed, or for some mothers that have late initiation of breastfeeding. Yes. So there are a number of it. Let me tell you some of them, because like virtually daily or frequently I see this. You see, okay, number one, breast milk substitutes shouldn't be advertised. Have you really seen advert of breast milk substitute on television or on the media? It's one of the code. It's among the code. Another is that it shouldn't be sold directly to the mothers. Okay. Yes, it shouldn't be sold directly to the mothers. It shouldn't even be sold to healthcare workers or given to them at discounted prices. No, it shouldn't be done. Yes, and and other things. Actually preparing this, my eyes were really open to see a number of things. But however, I do see some of them coming to, to sell those things. But it's against. So it is said that in countries that have adopted this international code for marketing of breast milk substitutes, exclusive breastfeeding rates has markedly increased. But there is still more to be done. So this is one of the things that should be strengthened. Then workplace breastfeeding policies. For example, they should be safe, like in organizations, in schools, in institutions. There should be safe spaces for mothers to go and breastfeed. There should be daycare. For example, in my facility, there is a daycare. Mothers freely go to keep their babies, and then at intervals go to breastfeed their babies and return to work. I remember while I was much younger in the profession, while I was doing house job, I would rush home to breastfeed. I had challenges with breastfeeding. I would rush home to breastfeed. I will have a call. Hey, baby's crying. I should come over. I will leave what I'm doing. I'll try to obtain permission and rush home because there was no facility. There was a time I had to even bring my baby in to the call rooms, and then you will see guys, you see everybody. So there was no safe space, at that time for for breastfeeding mothers. Even I tell you that bringing my baby had like some skin lesions as a result of bringing the baby and to lay them. So organizations should have those safe spaces. They care for mothers. That is another thing. Another thing is the mass media awareness we are creating. Because of this awareness, there is what increase in exclusive breastfeeding rates, and even mothers who breastfeed their babies even up to 2 years. For example, my 2 kids, I breastfed them to 2 years. Yes, it's not easy, and because
And
of
the baby
that,
will go and play football
and
come back.
Yes,
Is it not tedious?
that is what's supposed to be. And I tell you, especially for my last baby, they bond up till now. He's 2 years plus now. The bond is so tight. He will just come and want to peg. He's all. Do you understand? That is one of the things that makes you to be fulfilled as a mother. It comes from what? Breastfeeding, the bonding that comes from breastfeeding, and so many others. So we have to strengthen them. We call on government to strengthen those things that have been tested, those interventions that have worked. We shouldn't abandon them. We shouldn't leave the world or change the winning team, right? Yes. Thank you.
So thank you, Dr. Nyam. Now, this exclusive breastfeeding, I have heard a lot about, you can express the breast milk and keep it for the caregiver or whosoever. Do you now use the feeding bottles? I know that some of us suck feeding bottles, and we use feeding bottles for our children. Is that what you now use to feed the baby, or how do you go about it?
Okay, so because breastfeeding is very important, or the breast milk is very important, and you try to ensure that every avenue is explored even before you think about breast milk substitutes. So if the mother is not available, so to speak, yes, she could expressing breast milk also could be used to be able to measure the quantity of intake of the newborn, especially in special cases that we see in the hospital. The child is not growing well and you're not sure if the child is actually getting enough. You get the mother to express so that we can measure and say that, okay, this baby is getting this quantity or the other. Yes, so expressing breast milk is a good substitute, even if the mother cannot breastfeed the child directly. Now, concerning giving the child, first of all, the mother, yes, can express, and she can store it in the fridge. Okay, even some can go ahead to freeze it, for a few weeks. Well, depending on the light, if you have constant electricity, but we know the part of the world that we're in, so you could actually freeze for some time. But now, when giving the baby, we do not encourage the use of feeding bottles. Yes, and that is for hygienic purposes. Most times we see that it is a challenge to properly clean these containers. So as medical professionals, we would advise that the child is fed cup and spoon. Yes, so the baby is fed
what
with
about
cup
the
and spoon
of the baby?
Yes, it would be good, but usually it's expected that expressing the breast milk or giving express breast milk is temporary. So it doesn't take the place of direct breastfeeding. Yes, so give the cup and spoon so that you do not have to worry about diarrhea. You do not have to worry about infected bottles, and you do not know who is in charge of all of that. And, there's so many intricacies to these. So to be safe, it's easy to wash a cup and a spoon. Yes, and it's easy to sterilize them so they do not have all those nooks and crannies. Yes.
Beautiful. Yes, the cup and the spoon for baby Ngozi. You know that she's a beautiful baby and she must be sucked very well. So we'll take a break so that when we come back, we'll definitely give you an opportunity to be part of what we are discussing in the studio. And I'm sure that you have questions to ask, you have some myths or misconceptions to clear. So that opportunity will be yours immediately after the break. So let's take this time out. Yes, we are so glad that you are keeping faith with us on Healthcare Live from the Plateau Radio Television Corporation here in Jos. And we are looking at World Breastfeeding Week from the 1st to the 7th. And we're saying breastfeeding for a sustainable start in life. And by my immediate right is Dr. Nyam Kemin Kim. She is a registrar, Department of Community Medicine, Jos University Teaching Hospital. And to my far right is Dr. Lucy Uregu Ije. She is a registrar, Department of Obstetrics and Gynecology, Bingham University Teaching Hospital, Jos, and she is the Young Doctors Forum Coordinator of the Medical Women Association of Nigeria. So we'll give you an opportunity. The number will be there on the screen. You will call us, and when you call us, we'd love to know who is calling, where you're calling from, and please just go straight to the point. Just use some few seconds and make your concern or your question, and the number is already on the screen. So before we get any call coming in, Dr. Lucy, now under Medical Women Association of Nigeria, you are mothers in that angle from the Nigerian Medical Association. So what is your focus like? What are you dwelling on this year?
Thank you very much, Ma. The M1 joins the global community to commemorate this week-long event on breastfeeding. Yes, so however, beyond the international team, we want to emphasize, we have realized that yes, everybody is actually happy that or to tell what breastfeeding or the impact breastfeeding is having on the baby. And then they underemphasize the impact breastfeeding has on the mother. So we want to highlight that. We want people to really know. So M1, alongside other members like Pathfinders, ASPAP, are the one bringing about these projects. And what they say is that, for mother, we say mothers should not die because they are bringing to life. You should know that there are some mothers who die leaving their newborn, then who breastfeed them. However, this breastfeeding can be a tool or an intervention to prevent a mother from bleeding. Okay. We understand that bleeding after birth is one of the leading causes of maternal mortality. And Nigeria, do I say is the headquarter, or Nigeria is the leading, one of the leading countries with very high rate of maternal mortality. How does this actually come about? Immediately the baby is born, the placenta is also delivered. Then you see health workers will give an injection on the muscular area. That injection is oxytocin. Now, there are pregnancy hormones, progesterone. Immediately placenta is delivered, those hormones are reduced drastically. Then another hormone in the brain is stimulated, is released, the oxytocin. This oxytocin goes to have effect on the uterus, the womb. And what it does is that it compresses the womb, it contracts the womb. Because when a woman delivers and the womb is flabby, the womb is not strong, it's not hardened, the woman will bleed and can bleed to die. A number of women have bled and died like that. So now what M1 is saying, that when a baby begins to breastfeed, it sends a signal to the brain to release that important hormone that is called oxytocin. So you can see, beyond breastfeeding helping the baby, breastfeeding is helping to reduce the rate of mothers that are dying. And women should know this. And that is one reason why women should be encouraged to breastfeed, to be put to put their babies to breast within the first hour, and also to exclusively breastfeed the baby, and even continue after introducing complementary feeding, should breastfeed the baby even up to 2 years. And do you know that beyond that, let me tell you, another thing it does is that breastfeeding serves as what? A form of contraceptive method. We call it what? Lactational amenorrhea. It's expected that a woman who is breastfeeding exclusively, who breastfeeds on demand, who has not resumed her menses, that breastfeeding within the first 3 months, it can serve as a contraceptive.
Okay, so let's see who is on the line. Hello?
Hello, good afternoon.
Yes, who am I speaking with?
You're speaking with engineer.
Oh, sorry, we lost that call. Please, engineer, you can call us a bit again. Back, we would love to hear your own thoughts. So I hope you had landed before. Okay. So now, Dr. Nyam, we're talking about the benefits and some of the things that this breastfeeding does to the mother and also to the child. So in a nutshell, it is not only for the benefit of the child, but it benefits. Then what are other benefits of this natural breast milk to the family?
Okay. Breastfeeding is very important. It's important for the mother, for the baby, for the father.
Sorry,
Okay.
it seems he's back. Hello?
Hello, good afternoon.
Yes, so what's the name?
My name is Selbon Rasha.
Okay, Selbon, go ahead.
Yes, I am interested in the program going on.
Thank you.
I want to know the adding value on using feeding bottle to a very small baby. What
Okay.
does it take to use feeding bottle on a small baby of 3 days, 4 days?
Okay.
Is it encouraging?
Okay, thank you.
Use a feeding bottle to a baby under infancy?
Okay.
Please, I need more light on that, please.
Okay, thank you. Yes, we've spoken about it, but we'll still shed some more light.
Thank you very much.
Thank you, Selbon.
They are doing a good job.
We appreciate.
All right.
Yes, so
So concerning the use, sir, we are not encouraging you to use feeding bottle for your newborn baby or infant at all. It is not encouraged. We would prefer you use the cup and the spoon to feed your baby before the baby is able to latch to the mother's nipple.
okay.
Yes.
So it's not part of the shopping for the baby.
No, feeding bottle shouldn't be part of shopping for the baby. It should be the cup and the spoon.
Okay.
Yes.
Thank you.
And do you know that it's also part of the international code for, marketing those breastfeeding substitutes? Yes. So breastfeeding bottles are never allowed.
Okay.
They are not allowed.
Thank you. Yes, so before that call, we're trying to find out the benefits to the family.
So it's beneficial to the mother, to the baby, to the father, to the community, to the government. You won't believe it that you breastfeeding your child is important for the government of the country. So we already spoke about how it is beneficial to the mother. For the baby, first of all, we mentioned that there are antibodies or immunoglobulins in those breast milk. They help to fight infections in these children. You see that children that are exclusively breastfed, they tend to be healthier and not come down with common childhood illnesses. For instance, catarrh, diarrhea, and all of that. Exclusively breastfed children tend not to come down with this illness. Secondly, the breast milk, because of how rich it is, it helps with the growth of the brain, with the cognitive function of the child. You have a healthy child whose brain is growing well and doing well in school. You now see that this directly translates to the kind of adult that child will be. A very smart child will become a smart adult, and of course will be an adult that will contribute positively to the society. Also, is that a call?
Yeah, let me see.
Okay.
Hello?
Hello, good afternoon.
Yes, who am I speaking with?
You are speaking with Princess
Okay, Princess from
Apatama.
Okay, go ahead.
All right. So my question is, in the case when a mother dies immediately after childbirth, what measures can be taken to still give that child the necessary nutrition required?
Okay. Thank you.
All right. Thank you so much.
Thank you. So you can just land on the benefits, then she takes the baby that the mother dies.
Okay.
Yeah.
So the breast milk now is cheap. Yes, it's cheap. Now, this is the benefit to the father. Fathers are usually the ones that are responsible for the finances of the family. Breastfeeding is cheaper than buying breast milk substitute. If you just take a little survey in the market, you'll see that things are very expensive. So sustaining breast milk substitute is not even something that will be done, but we need the best to be done for the child. Breast milk is at the best temperature also for the child, and it is clean. You do not have to worry about infections, getting infected. Yes, except if the mother doesn't keep clean or keep the nipple clean. Now, talking about the community, you know that when you have healthy children playing all over the community, is way better than having most of the children sick, coming down with diarrhea or coming down with one illness or the other, transferring it from one child to the other. So you have a healthier community. And of course, for the government, when we have to go to the hospital at every point in time to seek medical care, it exhausts the resources of the government. Okay.
Yes. Thank you. Yes, that is beautiful. I love that. So the benefits are all around. It is not only for the baby, the mother, the father, but for everybody. So Princess is trying to find out a mother that dies at birth. How do you sustain that baby? What measure do you take to feed that baby with what it intakes?
Okay, fine. This question, I'm emotional about this because being a gynecologist and obstetrician in training, we've seen a number of women that died leaving their babies in the hands of others to care for. That is where these breast milk substitute come handy. The baby must feed. Okay. Yes.
Hold it at the baby must feed. We'll come back to it. Hello? Hello?
Yeah. So the baby must feed. I remember we had one woman, I don't know why, maybe my mother was not available, but I got to know that she breastfed my elder sister. She fed her one day, so I've learned that maybe grandmothers or others have helped to support to breastfeed. That was then. But a lot of illnesses, diseases, infectious diseases can be transmitted through breastfeeding. So in short, some can even go to the extent of buying some of the express milk, but they must thoroughly be screened if that route should be followed. But however, that's where the breast milk substitute, yes, are required. Okay, not for someone who is healthy, not for someone who can breastfeed, not for someone who has not breastfed it, or maybe had issues initiating breastfeeding in just a few minutes and then goes to pick one of the. No, when it is required in such a case, those breast milk substitute come handy.
So it is now the hospital that will advise on what to be done.
Yes, they advise them. Okay. They advise.
Okay, thank you. So now, we've in the course we've tried to talk about it, but let's still see some of these gaps that exist in the exclusive breastfeeding, and when we want to introduce the complementary feeding, what do we use? Which kind of meal do we use?
Okay, so for instances where the mother is not able to initiate breastfeeding and the baby needs to feed, or in the case of demise, or in the case of illnesses and all of that,
6 months of exclusive breastfeeding,
we're not going to advise, or we're not going to advertise for a particular product, but it is important that those products should be is it tailored to the age of the child? Usually these breast milk substitutes or milk in the markets have age gaps or age ranges for the child. So we'll expect that you should give the appropriate milk for the baby's age.
Okay.
Yes.
But if can I give the baby the food that the family is eating maybe after the exclusive breastfeeding of 6 months?
Yes. At 6 months, it's advised that you begin to introduce the child to complementary feeds. That's what we call them, complementary feeds. Not directly giving them what you eat, but you have to transition. Okay, so if the baby has been on only milk, you now start giving the child semi-solids before you now completely transition to solid food that the family eats. During that time, you give pap. We advise pap, rich pap, okay, or even for fortified pap. They're in the hospitals, they're being trained on how the types of paps to be given. You also train on you can give soups, you can give fluid, you can give fruits. All these things are good for the child, and after 6 months you should expose the child to that.
Okay.
Yes, ma'am.
So you said pap. Is it the normal pap that we take, that we make it from dawa, from gyoro, and whatever, or there is a special pap that the baby needs?
Yes, please. We do not want you to go international or to go to to go so far away because you're trying to feed your child. We all have these things available. Yes, apart from grains that we have here, maize, guinea corn, millet, okay, but you don't just give only these, because like we know there are different classes of food. You have to make sure that the baby's pap has all the major classes of food that the child can get to nourish their body. So most times we tend towards Tom Brown, where you combine a grain, granite and soya beans.
Okay.
Yes.
So you don't have to break the bank.
No, please do not break the bank, because we need it to be sustainable.
Yes, you don't need to break the bank. All right, the common things you use. All right, we are many times we're the one that want to just maybe want to feel among, or so that want to buy some of those stalled, canned food for the baby. You can go to the market, get those grains yourself, process them yourself. I do. I can't remember going to buy pap in the market. All right, I produce this thing from time to time for my baby, and they enjoy them. And then add milk, and everybody, even the entire family, feed on those things. I don't really have to go and spend so much money to buy those canned food before the baby is healthy.
Okay, but we flow Gen Z mothers and the like. She is feeding her baby with one formula, and the baby is looking to puppy, choppy.
So what good does that do? You're trying to break the bank to feed your baby. How long can you continue in that Gen Z vibe? How long? So, when you have this balanced pap, that you do not even have to use milk. Okay, then you use your resources to focus on other important things. So you have a wholesome pap that the baby and the entire family can use. You can buy eggs, fish, meat, crayfish, add to all of that. Please, there's no need to look at the glam or the whole Gen Z vibe. Do what is good for your baby. We need our babies to be healthy. We will need their brains to develop well, and you thank yourself and God for it when your child grows up to be that awesome human being that is contributing positively to the family
and the
what, society.
Doc, you know that most of those feed on the shelf, talk about the shelf life of those feeds. All right, the preservatives. When you go to market, you get those natural things, you mix them, within 1 week they're exhausted, you make another one. All right, so you are not scared that what you are giving your babies is unhealthy. Unlike some of those things, they can even be expired. They are produced in countries that we don't even know. Like, do you understand? So why don't we look deep into the things we produce by ourselves and for ourselves?
Okay, the grandma with the Gen Z mother, the way we used to breastfeed their father and their grandfathers, how should they blend with the grandmother with the Gen Z mother, trying to ensure that what she is taught in the hospital, she abides by it, and the grandmother is wanting to have her way?
Quite frankly, this is dicey, but I think that the family, or when it comes to a child, there are systems around the child. So the family, the husband and the wife or the mother, they have to come together to form a unit. That's why even antenatal, it's expected that both of them go for antenatal and get educated. Then they have to stand firm together, not just the mother fighting her mother-in-law or her own mother. The husband and the wife should stand together to make sure that whatever is done for the baby is in the best interest of the baby.
Okay, thank you. So, doctor, looking at the whole process, the whole week of breastfeeding and trying to sustain it and all the likes, what will you say is your package, especially at the Medical Women Association of Nigeria, and you want it emphasized for both the mother, the father, and the community?
Thank you. So within the week, on Tuesday, yesterday or so, some of our colleagues were on the radio. We continue to raise this awareness on the importance of breastfeeding for the baby and for the mother. We are saying that no woman should die because she's bringing forth. Who is she going to die and leave the baby for? What are the chances of survival of this baby when the mother is not available? Okay, especially with the high cost of commodities in market. So breastfeeding, mothers should be encouraged to breastfeed. We understand that there are a lot of challenges with breastfeeding. Some women have postpartum depression, some women have cracked nipples, some women have mastitis, some have engorged breasts, and a number of challenges. Okay, some women resume their work within the period of exclusive breastfeeding and prevent them from what? Breastfeeding. We want to say that breastfeeding is not just a woman's thing alone. The entire family, the community, the country globally should encourage women to continue to breastfeed. How do you do this? The father has his role to play. When a woman is breastfeeding or during that period, support by cleaning, support by washing, support by caring for the older children, support her when she goes for her postpartum clinic, support her in every way possible. Community or society, be kind to a woman who is in her postpartum period. A lot of things, hormonal interplay, a lot of things are happening in the mind of this woman, especially for a first-time mom who is so confused, about, the new life she has found herself. That is not time to be judgmental. That is a time to support her. Women have support groups. First-time mom, join support groups. You are not alone in this process. There are a number of women who are also going through what you're going through. If you are depressed, if you feel like you don't like your baby again, the baby you have waited for 9 months to bring forth, you have the baby in your hands, you begin to feel nauseated, seeing your baby, all the rest, please call for help. Okay. Seek medical attention. Come to the hospital so that you'll be evaluated and be supported, and you will return and you enjoy motherhood.
Okay, thank you. So what will you leave us with as your parting words?
By way of conclusion,
yes.
I would say that breastfeeding is a wonderful gift from God for bonding, for the good health of the mother and the child, and then the community, the entire family. So women strive as much as possible to breastfeed your child, 6 months exclusively and then up to 2 years.
Thank you. Yes, so that is the package today. Breastfeeding, it helps in bonding. Breastfeeding is of benefits to everyone, not only the child and the mother, to the father, to the community, to the government, and to us here in PRTV, because it is for our own good. And so we have talked about this wonderful baby, and let me name her in conclusion as baby Rebecca. Make sure that baby Rebecca, you hold the baby very well. You put the baby to the breast. Make sure that that baby takes a long time to suck one breast. Empty it before you will bring the baby to the next breast when it is another time for the baby to suck. And baby Rebecca will be growing choppy like this grandma Rebecca. So that is the package that we have for you on the program today, as I have had with me in the studio by my far right, Dr. Lucy Uregu Ije. She is a registrar, Department of Obstetrics and Gynecology, Bingham University Teaching Hospital, Jos, and she is the Young Doctors Forum Coordinator, Medical Women Association of Nigeria. We are indeed grateful.
Thank you.
Yes. And Dr. Nyam Kemin Kim, she is a registrar, Department of Community Medicine, Jos University Teaching Hospital. We are truly very grateful.
You're welcome.
Yes. And to all our moms, we say keep doing it, because it is for the good of your own baby. At least by 2 years, that is when you can win the baby. And for fathers, everything is at your own disposal to encourage that mom for the sake of the baby and all of us. So on that note, we sincerely appreciate those of you that did put your calls across to us. And until next week, when we'll come your way again with another package, God's willing, is yours sincerely, Rebecca Giot, on behalf of the entire production crew, saying goodbye and God bless.